Welcome to the session on how to do transfer orders in the system. Transfer orders are used for only in-house patients. They're not used for patients that are leaving the hospital or going to another hospital. So within the hospital, when there's a change in level of care, for instance, going to the ICU or going to a surgery, transfer orders are needed. And so I'm going to simulate the scenario where a patient has finished an operation, and therefore they're going back upstairs, and so transfer orders are needed. And so in this situation, the total knee replacement post-op orders were placed by the orthopedic surgeon, and the post-op anesthesia orders were placed by the anesthesiologist. And so we need to perform a transfer orders reconciliation. And so to do that, you would go to this reconciliations button and click transfer. And when you click that, you will see that a window pops up where it shows you all your orders in the system so far. These will include meds, labs, radiology orders, nursing orders, and so you would just choose which ones to continue, which ones to not continue. And so to be cognizant, be careful where there are certain orders that have a yellow colored icon, because some of those will be anesthesia orders. So in this situation, the Benadryl is an anesthesia order, and therefore we might not want to discontinue that upon transfer, because those will get discontinued in the PACU when they leave the PACU. So while they're in the PACU, we would want to leave them as continue. So many of the choices have been defaulted based off of the admission medrec. The only things you must decide is, are these meds appropriate to order? Are these labs or diet or activities appropriate upon transfer? So currently the patient is placed on NPO, and maybe you want them to not be on NPO, in which case you can select no NPO. You might want to add a diet like advanced as tolerated, in which case you will find it under the diets folder, advanced diet as tolerated. And click done and say tolerated to regular. And so you would see that when you minimize this window, that the advanced diet is tolerated to regular is present, and the NPO has been up here discontinued. So another thing I want you to be alerted on is this all button. What that does is it continues or discontinues all those orders in that subcategory. So if you were to unselect the all, it would make all these orders unselected, and so you could discontinue all those orders, but in reality you wouldn't want to do that. But if there was a scenario where all the orders were wrong, that's how you could quickly discontinue all the orders upon transfer. So here are the basic other set of orders. So many times there'll be nursing orders that you wouldn't want to discontinue, like educational orders here that you see, or perhaps the plan of care, education. So you'd want to leave these on. Influenza assessment. These are all done by the nurse and therefore are needed, as well as these communication orders that you're seeing for PACU only. If you were to hover over them, you see that these are needed for PACU, and so you would leave those on, and they would discontinue after the patient leaves the PACU. And so once you're happy with the screen, all the choices have been selected, you click Reconcile Orders, and that would reconcile all the orders upon transfer. Thank you.